This is our presentation on Angelman Syndrome by Terry Scheller and Jessie May.
Angelman Syndrome, or AS, is a group of issues that are caused by a partial deficit on the maternal side of chromosome 15. Since one chromosome is given from each parent, the paternal chromosome 15 is normal in this syndrome. It is also called happy puppet syndrome. It is caused by a lack of a certain protein in the developing fetus. The most common type is referred to as deletion type Angelman syndrome. It is a rare disorder. Children with AS are sometimes misdiagnosed as autistic or having cerebral palsy. There is research being done that shows that it may be related to autism due to the lack of the same protein.
Children with AS appear normal at birth, but then develop delays. In the first year of age, they can develop intellectual disabilities, language impairments, unusual gait or wheelchair bound. They can be hyper and have flappy hands and an inappropriate smile. Around the age of 3, these children can develop seizures. Usually about 80 to 90% of them develop these seizures. Sleep disturbances are common and GI issues are also common. In this picture, this shows a typical face of a child with AS. They have a small head, wide mouth, small widely spaced teeth.
The registered nurse would ask about siblings of the patient, their developmental timelines, especially walking and speech. Since AS is usually caused by the deletion of a gene, it's not always hereditary. However, if this UBE3A gene is inherited, risk of having a sibling would be 50%. So the RN would want to look for trends in the family history. The RN would also ask about other family members in current and past generations that have had developmental issues. Since AS was first discovered about 50 years ago, and it is a rare defect, there may have been misdiagnosed family members. Diagnosis can be confirmed by genetic testing in most cases. The RN should also ask about autism in the family, as there is research that has been connecting these two diagnoses.
This is how the gene is analyzed.
Nurses contribute to getting the parent in touch with genetic services. If the family brings additional family history information, it would be important to make sure it becomes part of the patient's history in the electronic medical record. The RN would access a list of resources available for genetic counseling for the patient and family. If that's hard to find, utilize social services at the hospital or clinic to help with this referral. It would be especially important in AS if the parent plans to have more children. Additionally, the RN would give support information to the family of the patient of AS. Since it's a rare genetic syndrome, the family will need support. Other families in similar situations may have some more up-to-date information on the latest research. There are Angelman websites where parents of the angels, in quotes, go for support and information. Some of these sites are angelmantoday.com, assert, which is support, research, and services for the family, and angelman.org, resources and education, which is also resources for the family. Additionally, the National Center for Learning Disabilities would be a really helpful resource for the family.
The role of the registered nurse in caring for a child with AS is very important. First, the general nursing care of the patient cannot be ignored. Depending on the severity of the characteristics, the patient may need help with feeding, walking, and decision making. As these children may stand out as different, the RN will have to keep all information confidential from visitors who may want to know what is wrong with our patient. Next, taking a thorough family history will be important, as stated earlier. So the RN has the role of investigator, looking for clues that would point to the genetic causes. The RN must document accurately so the rest of the team can work collaboratively for the best care of the patient. Genetic counseling should be considered as the family will want to know the probability of this in their family. The genetic specialist will look for the most common cause, which is the deletion of the gene. If that is the case, there is no increased chance of their other children having AS. They will also look for other causes. Then the family may want to participate in research studies that may, that may be ongoing. The RN could help the family find access to these studies if they are interested. They might want the patient's medical records brought forth for the research. In that case, the nurse could help them sign the correct release forms to allow this to happen.
The RN will need to be supportive of the family. They may be devastated by this new diagnosis, or they may not be aware of the support that is out there for them. They may just need a break to go out for a meal. They need to take respite time occasionally. The RN will need to let them know this is normal and healthy to take time for yourself, your partner, and your other children. Legally and ethically, the RN will be on the lookout for how the patient is being cared for outside of the hospital. If the caregivers are overwhelmed, there may be abuse or neglect of the patient. AS patients have a normal lifespan and they may outlive their parents. If the patient is in a group home or is being cared for by somebody outside the family, they may not have that same loving connection to the patient. Also, the RN will be a valuable educator in this situation. Again, since it's a rare disease, they may never have heard of this. They will need guidance to find resources to help them. The patient will need help their entire life. With a new diagnosis, they will need to find schools for special needs children and physical therapy for their needs. Some children learn to use sign language to communicate. The patient may need special devices for walking, eating, and positioning. They may have seizures and need safety devices. They'll need to have their drug levels monitored if they're on seizure meds. They'll probably routinely need EEGs looking at brain waves if they have seizures. They'll need individualized therapy that's based on the cognition of the patient. They will need to have behavioral evaluations, speech therapy and occupational therapy for motor and language issues. The RNs in the hospital or wherever they are taking care of these patients will need to remain competent in all their.
When explaining Angelman syndrome to a family of a child being diagnosed, you need to be compassionate. You also need to explain this in terms that they will understand. What I would say is that when your child was developing in your belly, it inherited a gene from both parents. Both genes need to be active, and when only one gene is active, it affects your child like this, causing Angelman syndrome. It's great we caught this early. There are treatments available. I'd also tell them that they're not alone. These are the references that we used for our presentation.